Here are some other conditions that can happen with the Tayum's esophageal cold, external cold disorder. We have three formulas here that are really wonderful in supporting these issues. The first issue we have here is wheezing and asthma. Okay, again, this is esophageal cold syndrome, so we'll see chills and fever. And the reason why this is happening is because the pathogenic influence is severe and yin stagnates in the chest. Mawang Tang is very, very, very commonly used in the clinic for wheezing and asthma, and it is powerful. It's miraculous. It works great for wheezing and asthma. In my own clinical experience, I've used Mawang Tang for children who have serious asthmatic disorders, have trouble breathing, and adults as well. And it's just amazing. Almost every time I've applied this formula for esophageal cold syndrome, I've seen incredible results. And the reason is because it's just a perfect combination of herbs. You have Mao Hong, you have Xingnen, you have Jiegung that are all just really good at clearing the lungs and supporting lung function. And then you have Mawang Zhongtong Tang. Now, Mawang Zhongtong Tang is very similar to Mawang Zhongchun Tang. The only difference, the last one we just talked about, the only difference is now we are experiencing acute chest and abdomen pain. So this is kind of the next level as the pathogen spreads to the abdomen, okay? And it also could be due to weakening condition of the body because of excessive coughing. This formula also works really good for parasitic infection. So Mawang Chongchong the first formula we talked about, is very similar to Mawang Chongchong as we talked about, but Mawang Chongchong the first one, the ephedra arrest wheezing decoction, uh, it includes Guangdonghua, and Guangdonghua is really good at releasing the exterior pathogen. Mahuang Tong has Longyanro, which is really good at opening up the skin pores to release the pathogen as well. I would say that Mawang Tong focuses a little bit more on the exterior, and Mawang Tong Tang, ephedra decoction for pain, focuses also on bringing or scooping out this pathogen from the interior, and that's why not interior meaning interior syndrome, but closer to the interior, affecting the abdomen as well, and that's why Longyanro digs a little bit deeper to get the pathogen out and opens up the skin pores. Then we have a formula called Bopewontang. Bopewontang simply means to tonify the source qi of the lungs. Bo, tonify pe, lungs, won is source, tang is decoction. So this is a formula used for congenital disorders, congenital weakness of the lungs. So if you look at the chart here, it says congenital zheng qi deficiency with external cold influence. If this young child, for example, has congenital zheng qi deficiency, they will be very prone to common colds and other external cold influences like spasms, muscle spasms, convulsions, for example, as wind makes its way internally, seizures. So Ijeoma says 10 or more bouts of diarrhea leading to Mangjingfeng syndrome. Mangjingfeng syndrome, in short, basically means seizures due to weakness of the lungs. And so as the situation gets even more critical, the use of Konyul Jejotang is possible. When would we see Konyul Jejotang used? Usually if the cold is so excessive that the Taeum is experiencing some edema and swelling of the abdomen. Jejo, which basically is grub, is excellent at clearing the water from the body, edema. And so is konyu, as we talked about before, ganli, which is the dried chestnuts.